This is an example of a case study for when connecting benevolence and non-malfeasance to ethical decision making and ethical dilemmas. This is the Charlie Gard case. Charlie Gard was an 11-month-old infant from the UK who suffered an extremely rare genetic condition called mitochondrial DNA depletion syndrome, or MDDS. This caused severe brain damage and organ dysfunction to Charlie, and his case garnered a lot of international attention since it was fairly recently in 2017 when a legal battle arose between his parents and the medical professionals on the team over the course of his treatment. The ethical dilemma with benevolence and malfeasance in the Charlie Gard case, we have benevolence, which is Charlie's parents. They wanted to pursue an experimental treatment in the United States, hoping that it would improve his condition. They wanted to possibly prolong his life, but with the non-malfeasance side, which is more of the doctors at the Great Ormond Street Hospital, they argued that the experimental treatment was unlikely to provide any benefits that might prolong, and it might have prolonged Charlie's suffering. They recommended withdrawing life support to prevent further harm onto Charlie. The conflicts within this study was Charlie's parents believed pursuing a treatment was a form of benevolence as it could give their son a chance of life. However, the doctors were prioritizing non-malfeasance, believing continuing the treatment would worsen Charlie's pain and suffering, and it wouldn't really give him a realistic chance of recovery. Um, This case was brought to court to determine Charlie's best interest given the disagreement between the parents and the medical team. Uh, the ethical decision making process involved evaluating potential benefits versus the harms. Would the experimental treatment meaningfully improve Charlie's quality of life, or would it just extend his suffering? They evaluated assessing his quality of life, and with no evidence of improvement and significant brain damage, medical experts concluded that further intervention would not have benefited Charlie. Then they also considered autonomy. While his parental autonomy is critical, medical decisions must also reflect the child's best interests when the parent's wishes conflict with the clinical evidence. The outcome of this case was that the court sided with the doctors, ruling that life support should be withdrawn to prioritize Charlie's dignity and avoid unnecessary suffering. The decision was upheld in appeals, and Charlie sadly passed away shortly after the life support was discontinued. The key lessons that were gathered from this case was the ethical decision making process requires a careful and meticulous balance of good, which is beneficence, and avoiding harm, which is non-malfeasance, primarily involving cases involving end-of-life care. The stakeholders' perspectives, including Charlie's family and also the healthcare providers on his team, and then additionally, the legal system must be considered to ensure decisions align with the patient's best interests. And finally, the Charlie Gard case highlights the importance of evidence-based medicine in guiding ethical choices while addressing the emotional complexities of such dilemmas.